We've actually studied heart disease and pollution outcomes in the past and found that there was an acute rise in admissions to the hospital for acute coronary syndromes during short-term elevations in particulate matter. And that short-term, by the term short-term, I mean days to weeks of elevation, and it's an acute rise. And then it will go back to normal, to healthy levels after several days or weeks. The historic evaluation of pollution levels in the area here in Utah on what we call the Wasatch Front. It's the most populous 4 counties in Utah where they're high mountain valleys. Elevations of the valley floor are 4,500 to 4,800 feet above sea level, but the mountains around the valleys ring the valleys and go up on the west from 6,000 to 8,000 feet, and on the east from 8,000 to 12,000 feet. And so the primary evaluations of air pollution have been in the winter, because something happens that's called a temperature inversion, where instead of the normal being warm towards the ground and getting colder with higher altitude, it inverts. A high pressure comes over, and cold air that's in the valleys, oftentimes because there's snow on the ground, that cold air gets trapped by the high pressure, and winds cannot come through, and the PM 2.5 fine particulate matter air pollution that's being produced by vehicles and industry and business and so forth will build up in the valleys, and that exposes the entire population to this acute elevation in air pollution. Well, during the summertime, inversions don't happen. And in the last decade, we've had increasingly severe wildfires that oftentimes the wildfire smoke is not from local fires, but from distant fires in California or Oregon, which are 700 to 800 miles away. And so this potentially elevated risk comes from distant fires. And we wanted to look in this study to see whether we can measure elevations in heart attack or unstable chest pain admissions for those causes to the hospital in conjunction with the elevation in air pollution. So we evaluated more than 20,000 individuals who were admitted for a heart attack or unstable chest pain to the hospital between 1999 and 2022. And we evaluated to see, was this occurring about the same time or after an elevation in air pollution? We found that in the wintertime, with those inversions, that we were seeing an elevation in risk in conjunction on the same day as the rise in PM 2.5 air pollution. That people were coming in with a heart attack in the wintertime, and that they did not come in, though, with unstable chest pain for more than a week after the elevation in air pollution. In contrast, in the summertime, when there was wildfire smoke, there was an elevation in same-day admissions for unstable chest pain, but not for heart attack. And it's something that's puzzled us for a bit and was surprising. We expected to see an elevated risk in heart attacks as well. But there was this elevation in heart disease risk. Turns out that unstable chest pain is a precursor of heart attacks. And so in addition to the physiology, the effect on the body that the air pollution may be acting on the body to increase the risk of heart disease problems, it appears there's some behavior involved as well, where individuals in the wintertime, when they have an acute heart attack and the chest pain and the pain radiating down the arm and the shortness of breath and inability to breathe, all those symptoms are combining to make it so that regardless of what's happening, whether there's snow or cold or so forth, they'll go to the hospital. But the unstable chest pain, where there's a little more opportunity to watch and wait and say, maybe this chest pain will go away. They've waited some during the winter time. But in the summer, when there's not cold, it's warm and sunny, and there's no snow. People are arriving early at the emergency department with their chest pain, and potentially they are getting the treatment quickly so that physicians are helping them to avoid progressing to that heart attack. And they're preserving the heart muscle. The chest pain will resolve with treatment, and they end up not having a lasting impact, lasting damage to their heart if they get there more quickly to the hospital. It was most surprising to me that we would see a difference in effect from the wintertime air pollution exposure and the wildfire exposure in the summer. And it's a possibility that there's some difference between the components of the particulate matter in the air, in the pollution in the winter and in the summer. The wildfires will burn all manner of materials, whether it's trees and bushes or structures and chemicals inside those structures and vehicles and so forth. So the components could cause a differential effect, but that behavior, the potential that there's some behavior involved in choosing whether or not you go to the hospital and the timing of that arriving at the hospital is really quite surprising to us. We had not considered that possibility, and it opens up the possibility that we can cause some change for the well-being of patients by counseling them to get there more quickly to the hospital when they have chest pain, so that even after a few hours of chest pain in the wintertime, having them decide to go to the hospital before they have a heart attack opens the chance that they can have that heart attack prevented and that they will not have lasting damage from it. One of the things that we've done over the last several years is work with physicians and nurses to understand themselves what the risk is for patients and understand who's most at risk. For example, we found previously that individuals who have existing coronary artery disease are at higher risk of having chest pain or heart attack during an elevation in air pollution. And so helping them to understand what the risks are for their patients and to be able to counsel their patients to be aware of the air quality and to stay indoors during elevation, whether it's from wildfire smoke or from other sources, that if there's an elevation in air pollution, that they should stay indoors, so they should exercise indoors. They should be sure to take their medications as prescribed so that they are protected from the effects of the air pollution. And then if they are having chest pain, they should go as soon as possible to be evaluated, because it could potentially help to extend their health span, we call it, that in addition to living longer, that they will have good health for a longer period of time if they can prevent the damage to their heart muscle by getting to the hospital before a heart attack starts.